Good afternoon, all, and welcome. Please be patient as the call populates. And for best viewing of this webinar, please make your gallery or your view into gallery view. That'll be most effective to see the presentation in its finest form. And we'll get started here in just a minute. Thank you. All right, we're going to go ahead and get started as the call populates. And again, thank you all for being here this afternoon to this Tattered Cover Presents. My name is Alan Frosch. I am a co-owner and the Chief Community Officer here at Tattered Cover. We are thrilled today to have you all here to speak with 2x2 Health and AARP of Colorado on this wonderful presentation. So I'm very proud to turn the mic over to Bob Murphy from AARP. Bob, thank you.
Thank you, Alan. It's our pleasure to be with you today. As Alan said, am Bob Murphy. I'm the State Director for AARP Colorado. We're a nonprofit, nonpartisan member organization working to promote the health and well-being of Americans 50 plus for more than 60 years. So today I'm thrilled to be joined by two caregiving experts and international best-selling co-authors of a book called The Confident Patient. And they're also medical experts, Beth Myers, founder of 2x2 Health Concierge, and Wendy Benson, partner at 2x2 Health Concierge. So welcome to you both.
Thank you.
Thank you for having us.
Our conversation today is important because there are 620,000 family caregivers in Colorado. Beth and Wendy will share step-by-step guides for caregivers on how to navigate the challenges of caregiving, and we all know there are many, as well as the complex healthcare system, especially during these days of COVID-19. We'll discuss advice for caregivers and on managing their own mental and physical well-being, very important. And we'll take questions from all of you as well. To join our live caregiving conversation, please post your question or comment in the feed, and this will place that question in our queue to discuss later on in the event. We'll do our best to get all your questions answered personally by the experts. So let's get started. Wendy, please tell us a little bit about yourself and why you and Beth wrote The Confident Patient.
Thank you so much, Bob. We really appreciate it. And a huge shout out of gratitude to all the caregivers out there. It is such a difficult job, and it's done with love, it's done with support, and people just do an amazing job supporting one another. So thank you for doing that. I've been in the healthcare landscape for over 20 years. I started as an occupational therapist and worked at hospitals throughout the country, and then obtained my MBA and became a healthcare leader for various trauma one centers and academic medical centers. For the last 5 years, though, I've been partnering with Beth Myers at 2x2 Health, where we really help people navigate the complex healthcare system. We wrote the book together, The Confident Patient, because collectively, we've helped thousands of patients and their families navigate the complexities of healthcare. And through that, we provide tips and tricks and strategies and questions that you can ask your medical team to make sure that you're all on the same page together.
Thank you, Wendy. The pandemic has impacted our lives, obviously, in so many ways. And even with vaccines and now reopenings around Colorado, there are continued challenges as caregivers struggle to keep loved ones safe and both mentally and physically healthy. So Beth, could you tell us a little bit about yourself and talk a little bit about coordinating healthcare needs and some of the challenges that caregivers face during the pandemic?
Sure. So I've been a nurse for over 20 years. I worked at Rush University Medical Center in many different roles: pediatric intensive care, abdominal transplant, bariatric surgery, and many more areas such as risk management. During my time with working with the patients, I noticed that there were gaps in care, and that's why I started 2x2 Health more than 5 years ago. We support families and caregivers by helping them communicate with their medical teams.
Can you give listeners compassionate, honest, and yet straightforward advice for family members and caregivers who are struggling. They struggle anyway, but especially during these difficult times during the pandemic.
Sure, and you're absolutely right. I mean, this has been a problem for longer than the last 15 months that we've seen. One of the challenges we've seen during the pandemic for caregivers is not having access to a loved one's medical team. We recommend 3 things for them to stay connected. One is make sure you have access to your loved one's patient portals. More than 90% of healthcare now are using patient portals. Number 2, it's also important that the medical team knows who in your family is the designated contact and has the updated contact information, including phone and emails. It's very difficult for, if someone's in the hospital, for the doctors to call 3 or 4 different people. We really need to find out who that one person is and make sure there's communication. And then 3, if patients are not allowed to bring another person to the appointment, talk to the medical provider about doing a telehealth call so you can be present. And most physicians, you know, a lot of times people will get stuck in the waiting room saying, no, you can't go back. Most of the time, if the doctor knows that there's someone here with you and they weren't allowed back in the room, they usually say, oh, no, please go get that family member or loved one. You know, they want the people there. So, you know, don't just stop with one person saying, make sure the doctor knows and really can make that call. Because I think the people, the people, when you check in, they've been given, you know, something to say to people and no, we're not doing this. But really, when it gets to the clinicians want family members there to help. It helps everyone involved.
Thank you, Beth. That's great advice all around. I particularly noted your comment about telehealth. You know, Colorado is something like the 8th largest state geographically in the United States. So sometimes people have a long ways to travel to get to their doctor. So if that option's available, that's really, really an important one.
Yeah. No, it's been great.
So Wendy, research shows that patients managing chronic disease or mental health issues may have anxieties about going to the doctor, right? Getting necessary lab tests or having surgery done during the pandemic. What are 3 questions that patients and caregivers can ask their medical provider to ease these anxieties about entering a doctor's office or a hospital for an appointment during these times of the pandemic?
Great question. And I think that, you know, across the country, different organizations in different states are following some different guidelines. So it is helpful to have some questions to ask so that you can really be on the same page with your medical team. First, you know, call ahead and ask what safety precautions the doctor's office or the healthcare organization is taking so that you can feel comfortable that they're doing the right things. See if you can bring someone with you. When Beth mentioned this, sometimes they can, even if an organization has a policy, sometimes exceptions can be made. And the other thing is sometimes you can FaceTime with your loved one while you're meeting with your medical provider. 2, are there forms that you can complete in advance? This has been a huge time saver. And I think this is something that's going to continue on even years from now, to be able to fill out all those forms in the comfort of your home or maybe with the help of a loved one instead of, you know, sitting there doing this in paper and pencil on a clipboard has been really helpful. And then 3, ask in advance if you should wait in your car instead of in the waiting room, depending on how busy the clinic is. There's been a lot of organizations that have implemented that policy as well.
Yeah, good advice. I know last time I went to the dentist, I had to sit out in my car in the parking lot and wait to be summoned in, right? That's just a sign of the times.
Right.
Beth, while patients continue to sometimes, unfortunately, get difficult diagnoses and need medical attention, what strategies do you have for patients struggling with making decisions on the course of treatment or second opinions for surgery, that sort of thing?
Yeah, you know, this was a really interesting part when we wrote the book. How other clinicians said they want people to get involved, and it was very helpful for us to hear because that's how Wendy and I feel about it. But it was great to have other people say the same thing. So number 1, make sure you have an open and honest conversation with your doctor and healthcare team about your concerns and fears. The doctor's goal might be something that's completely different than your goal. So you need to make sure you communicate what your goals are and what your fears are. 2, know the medical institutions are taking precautions to make procedures and treatments safe. They really are. And you have to think, out of all the businesses during the pandemic, a lot of them closed, restaurants, but really, in the end, the hospitals were the ones that were staying open. They really were getting it right. So I really do feel safe when I go to the hospital. It's not a place where I'm typically concerned. And then 3 is there's more risk for not getting a recommended treatment and staying home due to COVID concerns. So it really is important. If you notice something at home and you want to talk to your physicians, it really is a safe place. And you should make sure that you go in to see your clinicians.
Great, thank you. A fantastic answer for the question I asked, which was applicable to patients, right? But just as a quick follow-up question, what about, so how does the family caregiver who may be handling a large portion of this hands-on care engage with their loved ones on this very topic?
Yeah, you really need to listen to their concerns and offer up-to-date information to support that the medical treatment will be safe and is at more risk to delayed treatment. I mean, you really need to listen.
Yeah, good advice again. So Wendy, you're on the front line speaking to families about this issue and working with caregivers every single day. What type of involvement from patients, families, and caregivers have doctors mentioned to you that have been very helpful to they and their medical teams?
I think there's first and foremost is preparation. So talking about the doctor's appointment before you even go to the doctor's appointment with your loved one, writing down questions in advance, and knowing that you are prepared walking in there might even ease up a little bit of your anxiety. Approaching it in a prepared way just makes us all feel like, okay, I've got this. It's also easier to listen and take in new information if you have your questions written down in front of you. Lots of times people are trying to remember their questions and then they are not able to take in the new information that may be being discussed with them. It's helpful to take notes and take someone with you or have someone on your phone that can help with that. Again, sometimes what's being said is not always what's being heard, and it's extremely helpful to have an extra set of eyes and ears of someone who can be there with you to take notes and help you remember the questions to ask. And then third, it's really important as a caregiver, somebody who's supporting a loved one, to make sure that if there's confusing language that's being used, just stop and ask questions. We usually don't have an issue asking a waiter how something is prepared or what's in a sauce, but somehow we feel like we should know why somebody is prescribing a certain medication or a certain test. And it's okay to ask those questions and say, wait a minute, I just really want to make sure I understand this. What is this for? What are we hoping for? When will the results be back? Who will communicate those things with me? So really kind of just being aligned with your medical team as well as your loved one.
Great, thank you. And I'll remind everybody quickly who's on this call, please, if you have questions, please feel free to put them in, and we'll try to answer every single question that does come in. So Beth, tell us how stress can impact the physical and emotional state of family caregivers. So much attention, rightfully so, is paid towards the person being cared for, but sometimes we forget about the caregiver themselves. So how can a caregiver begin to alleviate some of that stress?
Right. Even pre-COVID, caregiving for family members was stressful. Now with added pressures for safety around COVID, there's more risk to the physical and emotional well-being. Stress affects us in many ways. A couple of different areas is from a medical perspective, the immune system becomes compromised with stress and makes us more vulnerable to diseases and viruses. It can cause further isolation and fatigue. We all have been mindful of caring our own mental health. Make sure you're not being emotionally isolated as well. Stress can affect your endurance. Caregivers need to make sure they are staying physically fit so they can safely do their jobs, such as lifting or transferring patients. And make sure you're tapping into other people in your network. If someone offers to help, accept that offer. It kind of goes back to on the airplane when they say, make sure you put your oxygen mask on before your children's, which sounds strange, but really in the end, it is important. You need to take care of yourself before you can take care of someone else.
Thank you. Follow up. We have a lot of statistics at AARP, and one of those is that heavy stress can have the unfortunate health consequence of being equivalent to smoking 15 cigarettes a day, right? So it's something that cannot be ignored or overlooked. So Beth, family caregivers do have a lot to fret about, and we know that worry doesn't help, yet that doesn't obviously stop it from creeping in. So if we ignore the stress as it builds on us, we can do that. But are there healthy ways to cope with all these challenges as well?
Yeah, one of the most important responsibilities for caregivers is to help the family members stay connected with their medical teams. And you can do that by making and keeping medical appointments. I know sometimes you don't want to go to the medical appointment, even if you've been at 2 or 3 that week, you're like, I just don't want to go. But it really is important to make sure you keep that medical appointment. Number 2, maintain medication and treatment schedules. For example, don't stop any medication for anxiety or stop taking with what your psychiatrist has said. A lot of times people say, well, I don't have depression anymore, and they come off their antidepressive medications. Well, then what happens 6 weeks later? They're depressed. So make sure you're not changing any medications without talking to your physicians. And 3, and if a medication is changed by one doctor, make sure all the other medical providers are aware and have the correct name and dosage. And a lot of times you can just do that by going into the patient portal and putting in a message, just saying, just want you to know my cardiologist changed my medication from this to that. And typically you'll just get a message saying, thank you, we'll update your medication list.
Great advice once again. So Wendy, let's talk about these modern times, let's talk about technology. And we know that embracing technology can be difficult during these changing times, and sometimes older adults in particular, occasionally I should say, don't have, say, the skills to use some of the modern technology. So how can caregivers and their family members utilize technology to stay connected with their medical teams?
What an excellent question. And we've all gotten a lot of education on all these technology platforms over the last year and a half, haven't we? I think it's really important for us to help each other with this. And, AARP of Colorado has a ton of free resources. And there are other sites as well that are how-to videos in terms of how to utilize and set up certain apps on your phone. You can set up medication schedules, for example. We can really embrace technology to help us during all of these, all of these adjustments that we've had to make. If you have a virtual appointment scheduled with a medical provider, you're going to want to make sure that in advance of that, you connect with the office to make sure that you know what platform to use. Sometimes you have to download something before you're able to access it, and to test it and make sure that you know who to expect the link from and how that will work. Be sure that you and your family members have access to the patient portals. We've mentioned that a few times. It's really important because it's such an easy way to communicate with your medical team. And it's also a way to send a question, receive responses quickly back, view some of the test results, and really be on the same page with your medical community.
So this question of apps and technology brings a thought to my mind. So caregiving takes many different forms, right? Sometimes you're lucky enough to have a caregiver living in your old household and say a multi-generational family. Sometimes you're lucky to have a caregiver live nearby in your hometown or a nearby community. But so many times caregiving is long distance caregiving, right? I mean, you've got a loved one in another state, another coast. Can you talk a little bit about special challenges that long distance caregivers face, and obviously their loved ones, and perhaps how even technology could help in that regard? Either one of you.
I know that even for lots of families, they've set up regular Zoom calls to communicate with one another instead of just trying to catch each other. I do think that technology can help with that, but it's almost like it requires some setup. It requires some thoughtful planning in advance. I know that there are many more group text chats than that people are a part of now to make sure that loved ones are on the same page and connected after a doctor's appointment for some of our clients. So it does take effort, but I do think that it really pays off in the long run for the multiple family members to all be on the same page and really be getting the same information. so that decisions can be made with everybody having the same understanding of what the priorities are.
We're really lucky that unfortunately this pandemic happened when it did, because if this would have happened 20 years ago before all this technology and the patient portals, it really would have been a different story. Now it's been horrible all around, but if we have to look at some positives on this, that's definitely a positive, is that we do have ways to communicate and that we didn't have years ago.
Yeah, that's perhaps the one silver lining is so many of us have become accustomed that we've had to learn how to use Zoom and Microsoft Teams and Google Meets and all those various platforms. And it's really gratifying to hear that family members have embraced that option as well during these important times. So this has been really, really helpful. All the strategies and advice, and Wendy and Beth, thank you so much for everything that we've heard thus far. What closing remarks might you have? And again, we'll have questions to follow this, but what closing remarks might you offer on being a family caregiver in this new COVID-19 world? Let's start with you, Wendy.
I think it's important to not feel alone, and that can be really difficult to do sometimes. But there are organizations that can support you. AARP of Colorado has an enormous amount of resources, local libraries, there are hotlines. And like Beth said earlier, and take people up on their offer to be of assistance. Reach out to people and stay connected. Caregiving is a really, really tough job, but what you're doing is so valuable. It's so important and it's so appreciated. So just know you're not alone. Surround yourself with a community that can help you, and keep on doing the great work that you're doing.
Thank you. Beth, thoughts?
The medical community is here for you and wants to help you. Make sure you are staying connected. If you or your loved one have medical needs or questions, your health team wants to know and they want to hear from you. You're not only important to your loved one, but you're also valued and important to others. You are the glue that is holding everyone together. So stay strong, keep up the fight. You're doing a great job. I know it's really difficult, but hang in there.
Great encouragement and needed encouragement for the difficult job of being a family caregiver. So we have a question here from Linda in the Q&A virtual room here. And it's a really interesting one. Either one of you or both of you have any advice on caregiving for your parents with siblings, especially when each of you has different opinions on how to provide the best for mom and dad? Holy cow, we could probably go for 30 minutes on that one, right? So let's open it up.
Easy one.
Yeah, let's get into some family dynamics here.
Yeah, that's a tough one. Yeah, and every family has it. I mean, really. I mean, everyone thinks like, oh, our family's different, but every family has it. I really think, if you could talk with the medical professionals and kind of see who's on the same page with the medical professionals and why, and maybe come up with a plan that way. Maybe would be a good start. Wendy, do you have any? You're usually
well, I know with our clients, oftentimes having a scheduled check-in time where everyone's present. Most of the time it's not in person. People have lots of responsibilities and live in different geographical areas. But I do think that coming from a place of inclusion and from saying to your loved ones, I know that the care of our parent is really important to us. We all want what is best for him or her. Let's all just get together on a phone call and go through some of the things that are happening and try to develop a plan together. I do think that at least starting the conversation that way is at least showing that that you're really shooting for the best for your loved one. And I think having frequent communication, maybe doing a weekly call, something like that, where you're focusing on priorities, it might bring people closer and closer together with the plan going forward.
And as we're talking about this, really, sometimes you need to bring in, someone else, like someone like ourselves, like an advocate. And you can find that online. You can search your area. Really, you need to make sure that the person you're working with has the best interest for the patient. And everyone might have something different, but really your advocate really has no skin in the game. They really are there to make sure that we get the care that the patient wants and needs met. So it might be something different than one of the child, wants in that direction the child wants to go in. But if that's what the patient wants to do, then we really need to listen to them. So maybe you need to bring in someone else that can help you have these conversations.
Great, thank you. As you both said, we opened up with a tough one there, didn't we?
Yeah.
Very, very delicate and difficult topic for sure. Any other, this is to the listeners, any other questions out there for our two experts today? Give you just a moment to chime in if you have any. It's a great opportunity.
And if anything comes up in the meantime, I'm sure we can get, our email is care@2by2health.com. If you think of something later, it's always one of those, oh, I wish I would have asked this. That would be fine.
All right. My stretching for time worked here. We've got a follow-up question. We got a couple of questions. A follow-up one from Linda, who asked about the siblings issue. Can you both talk a little bit more about getting a second opinion and how do you do that without offending your existing doctor, right?
Yeah, be honest. I mean, the doctors want you to ask other people. They want you to feel good about the decision that you make. They say, be honest. When you go in, say, listen, I was to another physician. This was their recommendation. What are your thoughts on this? And maybe they line up and maybe they don't. But if they don't line up, then at least you can then come back and say, this doctor said X, Y, and Z. Why are you thinking this? But if they don't know that this is a second opinion, then it's really hard and difficult to ask that question. So I really think you need to be honest. And I think, a good physician wants you to get a second opinion.
Great, thank you. I can't remember if it was Beth or Wendy, but you mentioned finding an advocate. And there is a question from an attendee about where do we find advocates like you, right here in Denver or wherever we live in Colorado. How can we go about searching for an advocate?
So they're starting to become more and more national organizations. But for now, there's a lot of different words that people use when they're looking for someone that can help kind of coordinate their care. Some people are listed as advocates. Some are listed as nurse clinic coordinators. I would say that when you're doing a search in your area to use a couple of those different words, because depending on what you need, some people may be focusing primarily on, like if somebody's trying to appeal something to Medicare, or someone might be wanting to look for somebody to help them negotiate a better rate on their bill from the hospital. What our team primarily focuses on is really kind of the clinical coordination of things. So those are some words that I would use in a search in your area.
Okay, good advice. Thank you. Here's another question. This is one that I have dealt with multiple times during my previous time as a family caregiver for in-laws, but what tips might you have for caregivers who have a loved one entering a facility after, say, a rehabilitation facility or temporary nursing home kind of a thing, congregate care facility? So what advice might you have for caregivers who have a loved one entering one of these facilities after a surgery or medical condition?
I feel like it's kind of like this squeaky wheel type of thing. You need to be there. You need to ask questions. If you're there and they see you there, I feel that you get better care, which I know isn't how it should be, but I feel like they know that, you're the eyes and ears of the patient, and that patient is going to get better care. So I definitely recommend that. The other thing I always recommend is to go through the medication list. When a patient leaves the hospital, they're given a medication list. Make sure when you go to the other facility, all those medications that they were supposed to be taking in the hospital are still being given. And a lot of times the names of the medications may change, but it might be doing the same thing. So make sure you're going through that and making sure, because the patient was discharged from the hospital on those medications. They were doing really good at a time when the hospital said, okay, we're ready for you to go someplace else. So it's important that they follow up on that medication regimen.
I'd also like to add, during the discharge from the hospital, a lot can get missed because people are often ready to leave the hospital and go either home or go to a facility. And they're often maybe not feeling that great. And so when the nurse or someone's going through their discharge planning, they may just kind of be ready to go. So you really want to look at that carefully before you leave the hospital, because if there are any questions, you want to be sure you're talking to either the nurse or the physician or someone on that medical team before you're off that medical floor, because once you're discharged, it's really hard to know who to ask those questions to, and also know what the follow-up plan is. So if as you're leaving, someone says, well, just follow up and make an appointment in 2 weeks. What happens if you call to make a follow-up appointment in 2 weeks and there are no openings? So you really want to make sure you're clear what the follow-up plan is, maybe even making some of those appointments before you leave the hospital, and say, if I have any questions later on tonight or tomorrow, what do I do? Who do I connect with then? So being really clear on that discharge is really critically important.
Yeah, and I would just add that, and not enough people know about this, but this issue of caregivers, family members getting the appropriate prescriptions and advice is actually a legal requirement in Colorado and many other states as a result of something called the CARES Act that was passed here in 2015, if I remember right. So it's not just obviously good practice on the part of the doctor, but it's a required practice that you as a caregiver or loved one get that information. We have another question, and I think Beth kind of anticipated this one in her earlier answer. But what questions should a family ask before transitioning a loved one into a nursing home or a senior facility? What are some of the red flags to look for, and what are some positives to look for in a facility?
I think a positive right now is they're allowing visitors to come in. And it doesn't need to be 20 of them, but at least one person. We've been in this pandemic now for 15 months. We know what we're supposed to be doing. I find it difficult right now. If someone said you can't have anybody in, I would have to question that. Right now, that would be a red flag to me. So that would be one thing, making sure the communication piece is just really, really important. And that they allow, I really think that's the red flag right now. You need to have someone coming in to see you, visually seeing you, making sure you're okay, and making phone calls if you're not.
Yeah, that's been such a really a heartbreaking issue for these past 12 to 15 months, and social isolation is enough of a problem already, and to have the situation with our loved ones in nursing homes not have any visitors, and then gradually evolve to virtual visitation, which is nice, but just not enough, right? So yeah, extremely good advice. So we have sort of an anecdotal statement here followed by a question. So one of the attendees here today says this: I look for an assisted living facility that would do specific things in relation to my mother's bipolar disease. They agreed to do things before admission, but a month into care, at the care plan meeting, they're no longer agreeing to manage these things. Is there any advice that you might have for others who might run into this or a similar issue, again, of promises not being kept?
Right. Well, the best thing I heard there was that they're attending the care plan meeting. They're having a care plan meeting, and someone is going to that care plan meeting. That is so important. So many people don't realize how important that is. So I'm really happy to hear that. No, I would really be, just straightforward saying, we had this conversation beforehand. So-and-so said this was going to work. It's not working now. And now you need to find a place. Maybe you might have to remove them and find a place that will. Mental health really, is a really tough area. A lot of patients, I think there's a lot more difficulty. There's not enough physicians working in this area, which is a real shame. We need to do a better job, and I'm not quite sure how we're going to get there. So really, calling them out and saying, listen, this isn't what we talked about, and we're going to have to find someone else to help us. And there are people we're in Chicago. There are other agencies in Chicago that do just this, help you transition people into finding the right one for you. So maybe contacting someone like that, an advocate too, would be an excellent person to reach out to. Greater National Advocates is an advocacy. It's on the newer side, maybe the last year or two, but you can go in there and start looking for advocates. I think that would be really important to do.
Thank you. Another question, perhaps our last one, but a very difficult question surrounding a obviously very difficult situation. But do either of you have any advice on caregiving for someone during the end of life times, particularly during the pandemic?
Can you repeat the question? I'm sorry.
Sure. Any advice on caregiving for someone during the end of life period, especially during these special times and challenges?
This was really an area that I, as a young nurse, didn't know much about, but working in this field now, I feel I've dealt with a lot of dying patients, and it really has been an honor to do that. And, just making sure that they have what they need and are comfortable. Maybe it's just baking a pie, their favorite pie, and making their house smell good. Maybe it's putting on the music that they like to listen to and just being quiet and there and holding their hands, and maybe giving them a foot massage or a back massage. Hospice, hospice is basically like home health, where they'll only come once or twice a week for a couple hours. They're not staying there for long periods of time. So if you do need help, it is it's an emotional, and sometimes it's a slow process. So really making sure that you have help there from other family members or caregivers that you hire, I think would really be helpful. You didn't sign up to be a caregiver. You signed up, you probably didn't even sign up to be a family member, but you really want to be the person there holding their hand and just making sure that they get whatever they need and are comfortable with.
Great. Well, thank you. And really thank you for everything here today. This has really been a fantastic, very educational discussion. I know we all as panelists hope that everyone has learned some new strategies for caregiving and for staying healthy. So Beth, Wendy, thank you so much. Alan with Tattered Cover, I'll turn it over to you, and I'll just say thank you very much for putting us together today.
Thank you. It's our pleasure, of course. And Wendy and Beth, of course, thank you for your expertise and your time here today. Thank you all for attending. This is one of an ongoing series of presentations through Tattered Cover on issues and challenges facing the community where we can be helpful. So please continue to look at tatteredcover.com/event for future events on these topics. And again, thank you for your time today. To Wendy, Beth, Bob, again, a pleasure, and we'll have a good afternoon. Thank you all.
Thank
Thank
you.
you.